Among everything else happening with the Trump administration, the president has ordered a pause on communications from several federal health organizations, including the FDA, the CDC, and the National Institute of Health as well. So this is all happening effective February 1st. And joining us to talk about the impact is our 9 News medical expert, Dr. Payal Kohli. A lot of us don't understand the role of these organizations. We know the titles and the names, but what can you tell us about them? Like, how do they really affect our day-to-day lives?
I mean, these are our front-facing organizations, Alex. So if you think about the pandemic, obviously the CDC was front and center when it comes to, any kind of public health emergencies, any kind of natural disasters like the wildfires in California. The NIH does a lot of our medical research. HHS is involved in Medicare, Medicaid, a lot of our sort of public health type of programs. And the FDA, as you know, device approvals, drug approvals, any kind of updates on food recalls or drug recalls or anything like that. So these are the organizations that are, I would say, front and center for the public to know what's happening, what might be imminent threats to their health, and what they might need to sort of do differently.
So then I imagine the line of communication certainly needs to be open. So what is President Trump trying to do? How would that affect how we hear directly from these organizations?
This is a hard stop. Nothing is getting out of these organizations. Not a social media post, not a public speaking engagement, not a scientific advisory, not an updated guideline. Nothing is getting out to the public without being reviewed by somebody in President Trump's cabinet and sort of being signed off on. Now, the good news is it's only till February 1st. But you can imagine this has never really happened in the last 2 presidential administrations. So it is certainly jarring for the heads of these organizations to get this kind of a message.
Yeah, and I'm curious what the purpose is there, because from your standpoint as a physician, does this affect you and how you interact with your patients?
I mean, the CDC, the NIH, the FDA, these are my eyes and my ears. These are what tells me what's out there, what I need to be looking for when I see a patient in my office with vomiting or with fever or with a respiratory illness. So I'm feeling cut off as a physician. The fact that there's the separation from these organizations, that I can't have a direct line to them. Now, of course, every administration wants oversight of these organizations because they're federal organizations, but we really have to keep science and politics on 2 separate planes here. And what makes me nervous is that this is really sort of blurring those lines. And so hopefully it's just a short-term mandate until they sort of get their feet on the ground. And if it expires by February 1st, no big deal. But if this is something that's going to be an ongoing precedent or behavior, that has me worried.
It feels like a serious problem. Why are we talking about formaldehyde of all things? Why is this a part of the executive orders?
So this was another executive order from President Trump's cabinet that said we're not going to take formaldehyde out of hair straightening products. So this is a chemical that is found to be toxic. It's actually been linked to multiple different types of cancers, and especially for Black women who might use hair relaxers or straightening products, uterine cancer and cervical cancer. So the FDA had actually planned to take it out in April, and then due to red tape, things got delayed, and it was supposed to be taken out of all the hair straightening products now, but the Trump administration has paused that, just like they did back in 2017 when they first came on, which was the last time it was scheduled to be taken out. So a lot of people are asking questions about, well, what do they do now? Is it safe to have these products with formaldehyde on the market? And the answer is no, it's not.
Well, and then what happens with them? I think it's hard not to feel like this is kind of a very direct attack. Obviously, like you said, these are in products that women of color use, but I'm curious what happens with the products that are still on the shelves that have this very dangerous chemical in it.
They stay on the shelves, which is why it's up to every woman, color or not, to check any of those products, to talk to her stylist, to talk to the salons, because I really do worry this is going to disproportionately affect women of color who use these products on a regular basis. And there's a lack of education, literacy, and insight into just how dangerous they are. And there's the assumption that if they're sitting on the shelf, they must be okay to use. Someone must have said that they're okay, but that's really not the case. They were meant to be pulled, and that's been halted.
Mm-hmm. Well, thank you for talking about this, because, there was almost over 100 executive orders on the first day, another 20, and something like this one kind of falls by the wayside. People aren't thinking about it. They're not paying attention, and you won't let that happen. So we appreciate you. Dr. Kohli, thank you.